Welcome everybody to your journey into the world of new aesthetic professional treatment options. Super exciting. That harness the power of nature's pantry and our skin's ability to repair and restore itself to optimal health. And we know healthy skin is beautiful skin. So introducing the wonderful professional tool, GlycoAla Bio. It's truly a unique therapeutic horizon. And why I say this is now we're in the time of the ideal procedure. We're going to shift away from the outside in, energy based, injurious procedures and procedures that we do that remove skin unnecessarily. And we're going to utilize treatment methods that coax the skin to a natural reset from the inside out. And in doing this, we're going to preserve the skin's natural architecture by working within its natural functions. So it's an auto-regenerative mode of action, and there's no destructive effects. And it's going to produce the healthiest, most lasting skin that we would all love. So the philosophy and methodology, we are going to start thinking about skin cell communication and what we're triggering. We want to trigger a downstream upstreaming effect because all the skin layers and cells are dynamically interconnected. They're all talking to one another and they're all working together. And with this, we want to be strategic in setting the skin up for self-repair. So here we have GlycoAla Bio Gel. It is the world's exclusive cosmetic biomodulation gel harnessing Spongilla spicules, which are Bio-Microneedling technology with 11 unique synergistic actives that render the skin a safe, inside-out professional treatment with very impressive results. So what makes GlycoAla Bio unique? So what I love about GlycoAla Bio is it's not only can you use it on any skin type and most skin conditions, but it's really a 4-in-1 treatment and it has multiple indications. So we have the synergistic benefits of superficial exfoliation, collagen induction therapy, and microcirculation, and with that, an enhanced penetration of these incredible bioactive ingredients. So therefore, what we're doing is we're working within a mechanism of controlled micro-injury that triggers this beautiful molecular cascade of wound healing, and you're going to have the most beautiful tissue as a result. So what is GlycoAla Bio used for? What are the treatment indications? Well, pretty much everything. Hyperpigmentation, photoaging, acne, scarring, enlarged pores. I've really seen a difference in my own skin with the pores, redness, dehydration, and stretch marks. So it really has so many, well, really when you think about it, what you're doing is you're triggering their skin to heal itself. So of course it has a broad range of indications. So what are the mechanisms of action? What are these Spongilla spicules? So Spongilla spicules are siliceous biological needles. They're microscopic, and they are derived from hydrolyzed freshwater sponges from Europe. So what they are, these Spongilla spicules, they're microscopic and they're very, very tiny, they're long, they're narrow, and they're sharp on both ends. And what they're going to do is they're going to provide deeper, faster, more uniform delivery of actives with 3 million microchannels. And what we're going to do is create an ability to absorb these actives as well. So not only are we triggering a collagen induction therapy by these little Spongilla spicules going down into our basal skin cell layer and triggering that downstream, upstream effect, causing the fibroblasts to interact and everybody to get going to create new tissue, but we're also getting these wonderful healing, restorative, reparative actives that are going to nourish our skin and give us the best result possible. So research shows that these spicules, what they do is they stress an auto-regenerative pathway. So when you use injury-based procedures, what you're doing is you're actually causing a different type of communication with the cells. When they have an injury, they're going to produce a different type of end result, a different type of tissue than when they are auto-stimulated into repair, biomodulated. It's going to be a much more natural, less inflammatory cascade of healing. So we're also going to activate pathways releasing these cytokines and growth factors, but once again, it's going to be a beautiful signature of molecules. It's not going to be an injury-based, scar-forming molecular cascade, as in many of the injury-based procedures. And really, when you think about it, you want to kind of think about physics when you're talking about like heat-based, cold procedures. What are they actually doing? Are they actually triggering the skin to a reset, or are they just altering the skin, injuring the skin into self-repair as a part of an immune response? So the process of the skin's natural healing, we're going to increase cell turnover, collagen production, and other repair mechanisms. And this is through a response in the skin that is triggering regeneration. And we're not really causing damage. We're just going to trigger in that very small area that skin reset, that skin's ability to, I say, survival of the fittest. Out with the old, in with the new, beautiful skin. So GlycoAla really is something that is completely customizable and for all individuals and skin conditions, that we will see. And one thing that we know about it is it's a high safety profile. Not only are you leaving the skin on after we've done research on day 3 and week 7 post-treatment, we've discovered we have no retention of the spicules, we don't have any swelling, we don't have redness, we don't have infection, etc. So this is really exciting. The safety profile of this treatment is very, very high. So with GlycoAla, we have these synergistic actives. We have these Spongilla spicules that are going into the skin, creating a downstream, upstream effect to produce new healthy tissue. We also have these synergistic actives, and this is what differentiates GlycoAla Bio from many other types of procedures as well, because we're getting all of these healing components, anti-inflammatories, brightening, antimicrobial, nourishing, skin barrier enhancing, synergistic actives, niacinamide, Rosa Canina seed extract, bakuchiol, arbutin, magnesium ascorbyl phosphate, vitamin C, lacunolactone, which is very hydrating. We have a spirulina maxima extract. We have all these marine extracts, brown, red, and green algae. And these are going to give us all of the protective, anti-inflammatory, restorative, healing, energizing, all of the things that you can think the best of nature's pantry would have to offer. So the beautiful thing about the power of GlycoAla Bio synergistic actives is that we are able to use these fabulous ingredients that are going to interact with one another, piggybacking on one another to fortify their benefits. So we use lower doses of constituents, reducing the possibility of adverse side effects. Let's talk about the power of GlycoAla Bio's synergistic actives. We have niacinamide and Rosa Canina extract, making a far more potent antioxidant effect. Niacinamide and bakuchiol, we're going to have the vitamin A-like effects with niacinamide that calms the skin, anti-inflammatory, and wrinkle fighting, and strengthens the barrier. It's going to have effects for acne, hyperpigmentation, and signs of aging. We have marine algae and spirulina. They provide a soothing boost of hydration at the highest possible level. We have marine algae and Rosa Canina extract. We have the free radical protection at the highest possible level, and marine algae and niacinamide, and it's going to enhance that antioxidant benefit, and we're going to have intensify the brightening effects to the skin. Now that we understand the product a little bit better, we have the mechanism of action, we have our Spongilla spicules, our tiny little microscopic needles, and we have all of those wonderful ingredients that are going to get deeper into the skin so they can have an effect. So when we did our clinical research, the treatment area was cleansed. We applied 5 to 6 months of the GlycoAla Bio Gel, and we massaged it into the skin according to the skin type and the skin condition, tolerability, etc. And what we did is, after we did that, we left it on the skin for 10 minutes, and then we provided a couple of pumps of Revive, which we're going to talk about in just a minute, and that was applied after, and then that was sent home with the client. SPF was used every day, and then we repeated the treatment every 2 weeks for maximum results. 2 to 3 treatments 2 weeks apart. And that's going to piggyback on that skin cell signaling and that downstream, upstream effect. So the Revive is the post-care, is the finishing part of the protocol, GlycoAla Revive. And GlycoAla Revive is a moisturizing, calming, soothing, and repairing gel that's also antimicrobial. It's going to be your best friend after this treatment. It's the second part of the protocol, and your customer it'll be a seamless experience if you send them home with this. And what it has aloe, niacinamide, sodium hyaluronate, Centella asiatica, and propolis. So it's very calming, soothing, worry-free, seamless experience for your customer. So what are the features and benefits of GlycoAla Revive? Look at all the things that it does. It's soothing. It helps relieve redness, itching, swelling, dry and tight skin. Everybody hates that. Skin exfoliation, dehydration. Everyone hates that. It's going to restore that barrier faster. It's going to keep our skin safe. It's going to reduce the inflammation and help with the itching or flaking or stinging or any type of side effect, unwanted side effect. What are we looking at when we do a GlycoAla treatment? So when we are done with the procedure, when we've applied it, we've massaged it, and we've given it 10 minutes, we've applied our GlycoAla Revive, and then we're going to send the customer home. We will, of course, have done a very thorough consultation. And then in the consultation that we're going to explain to them, they're going to have an inflammatory phase. Remember, it's a non-injurious inflammatory phase. It's going to trigger skin cell signaling and healing. That's going to last up to 48 hours. And so the first evenings, which I've experienced, they are the most red, sunburnt feeling. They're going to feel really dry. They might have minor itchiness, minor swelling, and sensitivity, but that's why you have your GlycoAla Revive. So during the proliferation phase, physical exfoliation will start to happen, a couple days after, maybe 3 days after, when the redness subsides. And the skin can also feel tight and itchy during this, but this is when the spicules are going to desquamate out of your skin. So what we have to do is we're basically implanting these microscopic biological little needles to trigger that downstream, upstream communication cascade along with those wonderful actives that are going to restore and give us a healthy skin as possible. So we want to make sure we adhere to the protocol. This is how it's been studied, and this is how we know it works. And this is going to encourage you to just stay on track because we've studied this, we know it works this way, and it's keep you out of trouble. So let's look at some clinical case studies. So here we have inflammatory acne, and now this is just after 3 sessions. Remember, 2 to 3 sessions done a couple of weeks apart. And of course, with acne, our application would just be to apply it, basically just get it on the skin, leave it for 10 minutes, and then do the Revive and send them home and let them know they're probably going to have a little bit of purging in between. So you have to strategize a treatment plan that accommodates for this. And also, the more you educate them and give a thorough consultation and set expectations, they just need to push through, and then they'll get to their next session, and then they'll get to their next session, and they will see their skin clearing up and giving them great relief. I love it for facial hyperpigmentation because really what we know with hyperpigmentation, it's damaged skin cell communication and damaged cells, maybe damaged keratinocytes, maybe damaged melanocytes, and maybe both, but their communication's off. They're not doing what they're supposed to be doing. And this is often really tricky, and it can take time to do it from the inside out, do it the right way. So with this procedure, what we're doing is we're triggering a faster skin cell regeneration. We go from basically a 28-day ideal skin cell turnover to a 7-day ideal skin cell turnover. So that's what makes it so impressive and change, especially with pigmentation and things that are difficult and take time to happen so much more quickly. We have hyperpigmented and acne, like post-inflammatory hyperpigmentation. People hate that, once you get your breakout cleared up and then you have to deal with the hyperpigmentation. This is just going to make this more of a seamless, quicker journey for your customer. Here we have aging facial skin, enlarged skin pores, and skin roughness. So see what it does. It does so many different things for the skin. It's going to help with hyperpigmentation. It's going to help with laxity. It's going to help with fine lines. It's going to help with texture, pore size, all of those things. As we said, the skin is resetting itself. It's healing itself. So of course, all of those indications are going to be addressed. So we know this is a holistic therapy. We don't need a machine. That's great. So your return on investment is huge. We have a natural, non-invasive treatment, minimal discomfort, minimal downtime. It is a very unusual and different experience the first time you do it. Some people find it, oh, it's prickly. It feels like little needles are going to your skin. You get used to that very, very quickly. It's just a different sensation. It's an inside-out mechanism of action. Therefore, we're going to have lasting results. We're going to need fewer treatment sessions, and it's going to be time and time efficiency huge, 25 minutes in and out, and labor reducing for you. Suitable for all skin types, face and body. And what we love about it, it's super safe, no skin breakage, and non-injurious. Super important things to remember and to be able to convey to your customer when you're doing a consult or trying to explain to them how this procedure works. It's truly timeless, using the wisdom of our bodies, using the wisdom of self-healing, of our ability to, given the right tools and the right ingredients, to really make a change in our skin that is going to be as natural as possible. So we will get into the contraindications and precautions just briefly. So we obviously don't want to treat broken skin. We don't want to treat skin that is been compromised in any way and also has any type of dermatologic issue happening. So what we want to do, highly reactive skins or super dehydrated skins, what we want to do is we want to assess all of this in our consult, maybe do a little skin sensitivity test on the forearm 24 hours before or during your consult phase, just to make sure that your customer is aware of how it's going to feel, and also they don't have a hypersensitivity to the product, which, because we're using 11 synergistic actives at low levels, this should not be an issue. So I just wanted to give you a little introduction into GlycoAla Bio and GlycoAla Revive. We will have a more in-depth webcast to talk about the ingredients and a little bit more about the mechanism of action, a little bit more history. But all in all, this is a very exciting time for professionals to have another tool in their armamentarium of wonderful aesthetic approaches and procedures. This is something that I have really embraced. My customers love it, and I love it for myself and my own skin. So thank you very much, and I'm excited for your exploration.